Everyone. I'm here with Indigenous Services Minister Patty Hajdu to talk about the implementation of our National Inuit Suicide Prevention Strategy and additional resources for implementation. In 2016, Inuit Tapiriit Kanatami released the National Inuit Suicide Prevention Strategy. It was the first strategy in ITK's history where the federal government met our strategy with funding on day one. At that time, we had done work across Inuit Nunangat to create a strategy that's globally informed, evidence-based, and Inuit-specific. It focuses on a number of issues, whether it be to address protective factors and to provide more supports for Inuit children, or to address risk factors and the concerns in relation to suicide prevention on mental health and on child sexual abuse and on a number of other challenges that have been created through colonization, created through some very challenging realities in our communities, but ones that we know that we can work on from a systemic level to change. We have been implementing the National Inuit Strategy, or the National Inuit Suicide Prevention Strategy, with our partners across Inuit Nunangat, Nunavut Tungavik, Makivik Corporation, Nunatsibu Government, and the Inuvialuit Regional Corporation are the ones that are recipients of the funds and the ones that are delivering services and programs. We at ITK have convened events. We have created partnerships. And we are doing the national level work on the implementation of the strategy, but most of the good work is happening in community. In 2019, the federal government, through Budget 2019, announced $50 million over 10 years for the continued implementation of our strategy. And we have been working on the implementation of that since 2019. Minister Hajdu is here to talk about additional funding in relation to our implementation efforts, which are very much welcome. We have an ongoing challenge of suicide and suicidal ideation in our communities. We know that we need to do more, especially for young Inuit who are most at risk of suicide. But we also know that we have to do more to create protective factors in youth and to try to do our best to ensure that our children grow up in healthy, loving, safe homes and are supported through many different social determinants of life, considering things such as poverty or food insecurity, concerns around education, housing. These are all things that interplay, that then ultimately end up being risk factors that we know have compounding effects when it comes to suicidal ideation. Every last Inuk across this country has a connection with suicide. We all have lost family members and friends, just important people in our community. And so this money and this focus from the Government of Canada is very much appreciated, but also is something that is necessary, because the rates of suicide, from 6 to 25 times the national rates for Inuit, are unacceptable, and an unacceptable public health reality. And the ongoing work that's necessary is not something that is going to be done in 2 or 3 years. This is a generational fix. But we will do all that we can and partner with who we can on suicide prevention moving forward. And I'm very pleased that Minister Hajdu and the government has taken this issue seriously, and we continue to work together on it. Minister Hajdu.
Thanks, President. Good morning, everybody. Thank you very much, President Obed, for those thoughtful remarks. As President Obed said, this has been an effort of our federal government now for a number of years to support Indigenous-led and designed strategies to address suicide prevention and life promotion. Monday is World Mental Health Day, a day to I suppose, think about how the impact of mental health on all of our communities and the challenges that I think all of us know we face in terms of supporting people to live their best lives possible and to have the resources they need when inevitably things are darker. We held the first ever Indigenous Mental Wellness Summit just a couple weeks ago. And I have to say it was truly an amazing event. I'm hoping and I'm planning on trying to ensure that this event is an annual one. It was amazing because we facilitated Indigenous leaders from across the country to come together to share mental wellness programs, substance use treatment programs, other kinds of support programs that are working in this country, and that are working because they are Indigenous-led and they are Indigenous designed, and they come from the grassroots up in many cases. And I want to commend President Obed and ITK for supporting that approach across Inuit territory and making sure that community groups and Indigenous people in the North have access to those supports and those programs that are designed by people for people. I was reflecting on my own journey as a young person through many different kinds of experiences in my life and the kinds of supports that were available to me in the communities that I lived in. You know, in my early 20s as a young woman in Toronto, and then later on as a single mom, there were many times that I needed to reach out for help. There were many times that I needed support for some of the challenges that were facing me. And they were there. And they were there for me, and not all of them were of equal quality, but they were there for me when I needed them. And not everybody has that experience in communities across this country. Not everybody has access to supportive programs or supportive people or approaches that truly are built to help people when they need it the most. And so today, I'm very excited to announce an additional $11 million to support the ITK suicide prevention strategy. I know that President Obed is leading difficult conversations on this, both on the side of protective factors and risk factors, understanding why someone wants to take their life, and trying to address those risk factors, whether it be the social determinants of health, as we've talked about, but many other things, and then understanding how we protect people and support people when they are in those dark moments, so that there is a hand, a voice, someone on the other end that can help them through that dark moment and see a reason to live to the next day. This is incredibly, incredibly important work. I can't think of anything more important, actually. So it's an honor to be a partner. It's an honor to support this work, and I really look forward to hearing all about how the money will be spent to improve the lives of Inuit across this country. Thank you. And we're open for questions now.
So how exactly will this money be used, and how will it reach communities most in need?
This is funding that is specifically for the next 2 fiscal years and will be utilized by ITK through the processes that we've already established under the implementation of the funds to date. So when new allocations are created, our board of directors uses a funding formula to allocate funds to our 4 Inuit regions across Inuit Nunangat. Each of those 4 regions also work with Inuit outside of Inuit Nunangat within the distribution and the uptake of those funds. It will be up to regions to decide which priority areas they will focus on under our national strategy for the implementation of these funds. We know that to date there have been programs in relation to creation of an Inuit-specific mental health first aid. We've done a partnership with Kids Help Phone. We work within regions for things like poverty reduction and housing and food security. So, we also have worked on child sexual abuse, national conferences, and other work in relation to curbing child sexual abuse. So this could go in a number of different areas, but under the umbrella of the implementation of our National Inuit Suicide Prevention Strategy.
And since 2016, since you've implemented this strategy, have you seen suicide rates reduced at all?
Actually, suicide rates in general are very difficult to calculate, especially from an Inuit-specific lens. We are working now with the RCMP and with coroners and with jurisdictions to try to come up with an MOU or some sort of working arrangement so we would have a better understanding of deaths by suicide that also has an ethnic identifier with it. So the work that we have done to quantify deaths by suicide has often been piecemeal, and our own researchers reaching out to every last coroner and every last jurisdiction to get information. We want to make this more readily available so that we can use it as a metric for success. I do not believe that there has been a sizable decrease of deaths by suicide. It is only one indicator, and the overarching ideation is another indicator across our society. And ideation also is very tough to quantify. So we know that we have to work on those risk factors that lead to ideation and lead to completed suicides. And then also on the protective side, it is also hard to quantify how many times you might have been influential, or the strategy has been influential in creating resilience amongst Inuit who may have otherwise been at risk if they did not have access to these programs or services. So the evaluation of this is an ongoing thing, and I think from a global perspective, evaluating suicide prevention measures beyond just the rates of suicide are very hard to do, but very meaningful, and we'll continue to use these funds on the evaluation lens as well.
I was speaking to a teacher in the smallest Nunavut community, Opaluk, and he was telling me that in his community, suicide is all too common, and they don't feel the presence of the federal government or ITK in preventing suicides there. How will this funding possibly make sure small communities like Opaluk are not forgotten?
Through the Inuit Tapiriit Kanatami structure, we do some work at the national level. We do communications work. We host national conferences. We make partnerships with national organizations who then perhaps do work at community levels. But the largest part of our work is to convene the 4 land claim regions, and for those regions then to be empowered to do the work on implementation. In Nunavik, Makivik Corporation has a relationship and sometimes allows for the health board to be the major person at the table when it comes to social issues such as things like suicide prevention or mental health. And so sometimes the work that happens at the national level is not directly known at the community or the regional level, even though the funds have been allocated and the work is happening in concert. There are always more things that we can do at ITK to help people in communities. These funds, especially from the communications work that we can do, and also from the national convening factor of the work, we can play our role. But certainly it will be each of our land claim regions and the programs and services that they design and implement that will have the greatest effect at the community level.
Do you have a follow-up? And the other thing I wanted to ask you is that yesterday it was announced by Quebec's Human Rights Commission that they were investigating alleged abuse of an Inuk youth within the West Island hospital system. There's allegations that he was in a youth protection home and was put in isolation and developed health issues. I'm curious, this is the second time this has happened in the past year. I'm curious if ITK and the federal government should have more involvement in how Inuit children in that province's youth protection are treated.
Yes, and I think this goes to the Supreme Court case that will be heard this fall in regard to Bill C-92, the Act respecting Inuit First Nations and Métis children and youth. The control that Inuit rightfully have around child welfare and the welfare of their children, of our children, is something that the government of Quebec is actually protesting. And The work that we do has to be also supported by and in partnership with the jurisdictions in which Inuit live. And in each of our jurisdictions, we must do more for Inuit children in care. That we have to protect those who are most at risk and those who need our help the absolute most. And also from whether it's Auditor General's reports for the child welfare systems in Nunavut or these extraordinarily difficult cases that we are hearing, these awful cases that we're hearing from Nunavik and other places. It's where we need to spend our resources and our time and where we need to do the most work, because ultimately it's scenarios like this, if they are systemic, that lead to risk, that leads to suicidal ideation.
I might just add, I think that is the transformational power of C92, and I would echo my colleagues' comments about really hoping that provinces and territories across the board understand the transformational power of restoring the rightful determination of child and family care to Indigenous communities and Indigenous regions. It is a long journey, and there is a lot of work to do, but just you know, in the few cases that I've had an opportunity to meet with communities that are doing that transformational work, that are signing agreements with provinces and the federal government to restore the care and control of children and families, there is a huge amount of opportunity for not just Indigenous people, but indeed all of Canada. What we want ultimately are citizens that are healthy and productive and reaching their full potential. And that can't be done in a broken child welfare system that doesn't put every child at the core of their work. And so this is the transformational power of C92 and why the federal government is vigorously defending this legislation. Thank you.
Minister, I want to ask you about your government's decision at this point to not legislate fire codes on First Nations. Policy experts, the Aboriginal Association of Firefighters, the Canadian Association of Firefighters, Indigenous leaderships have long called for this fix, for the federal government to legislate and then properly fund First Nations' ability to actually implement fire codes. So can you take me through specifically why is your government not taking this step?
Well, I think I said this in the release. I'm open to legislation, but what I have learned in the last year as a Minister of Indigenous Services is that legislation alone will never fix a problem on First Nations. There has to be, as you've pointed out, sustained funding, and more than sustained funding, there has to be capacity. I'm willing to work with all of the invested and interested partners in understanding what the legislation would look like, and furthermore, what we need to do on First Nations to protect lives. There is nothing more heartbreaking than having to phone a chief or speak to a family who has lost anyone in a house fire. Indigenous children are in the range of 81 times more likely to die in a house fire than a Canadian non-Indigenous child. These are horrific statistics, and I think anybody hearing them would want to do more. The question is exactly how to get to the outcome and to make sure that people have the capacity in communities to both do fire prevention, as many fire preventers have talked to me about, and also address fires when they happen. And so that's the work that we're doing with partners. But I am open to legislation, providing that that is exactly the solution that's required in this space. Again, legislation without all of the other foundations can be very hollow.
Are you going to be taking this to your colleagues? If you are open to legislation, I should say, are you going to be taking this to your colleagues and seeking the funding that it would take to actually make this legislation able to be implemented?
Well, I mean, absolutely. I think one of my primary goals as Minister of Indigenous Services is to advocate for the equity and funding that will be required to close the socioeconomic gaps by 2030, which, by the way, is a very, very open goal of this government. And that will require funds, but it will also require all kinds of other things. And so, yes, of course, I'm going to advocate for the necessary funds to reach those goals.
Mr. Hajdu, what are your concerns from some Indigenous?
Can I get a question? Waiting for a while. Yeah, so the Liberal Platform 2021 pledges $4.5 billion to mental health. And by my running through the numbers last night, it works out only in this year's budget to about $500 million over 5 years for not only mental health in general, but Indigenous mental wellness. So that's really, even with this announcement, you're really far off what you pledged and ran on the campaign. So why the difference?
Well, the larger pledge was, I think you're talking about the inclusivity of the transfers to provinces and territories. And so, as you know, the Minister Duclos is actively involved in those negotiations, including continuing the work on mental health standards. You know, transferring money to provinces and territories is important, of course, but we all want to know, like President Obed talked about, that that money is in fact transforming access to care and the quality of care that people are getting. That's the work that Minister Duclos is doing with provinces and territories. There's also, I'm going to guess here, I think it's $345 million in budget 2022 for Indigenous specific mental wellness care, and that work is continuing right now to determine how best to unfold that money.
It does really seem far off, though, of what you campaigned on, and as you know, this is a serious issue. It costs probably billions and billions of dollars, so really, do you think that, I mean, why the discrepancy? I guess you campaign on one thing and reality is another financially.
Well, I don't know if there is a discrepancy. This government has been committed to mental wellness and mental health, including, by the way, a transformation of the Canada drug strategy and the way that we address substance use in this country. All of those things are important. The National Housing Strategy is an important mental wellness contribution to ensuring that people have access to decent housing. You know, listen, the reason why I believe I'm a federal politician is because all of those social determinants are actually related to mental wellness. When I go out and campaign at the door, people are talking about mental wellness, but they're not just talking about treatment programs, they're talking about all of the foundations of mental wellness in a community. So all of that work goes together. In terms of the ongoing work with the provinces and territories, I think that the government is on the right track in terms of making sure that the investments that we are making in mental health and mental wellness are actually tracked, that there's data attached to it, that there's an understanding that that money is actually reaching community members in their times of need, and also looking at those protective factors that President Obed talked about. Thank you.
I was wondering if we could get your reaction to some concerns we're hearing from some Indigenous Child and Family Services. They see the changes that your government is making towards revising this whole system is moving too fast, and that some kids could fall through the cracks who are already being prevented from entering the care system, child welfare, because they're part of these services. So what would you say to those concerns from the Indigenous child welfare agencies that are already doing work to prevent kids from going into care?
Well, I think nobody wants to see a child go into care, and so I'm very focused on prevention as well. But again, I would say that the government is, you know, really laser focused on two things. One, transforming our own systems of care, and that work is happening, as you know, through the historic $40 billion settlement, $20 billion which is set aside for the transformation of child and family services that are supported through Indigenous Services Canada. All of the parties that are engaged, including the Caring Society, are at the table and are working on the very detailed agreement that hopefully will have concluded by the end of December. But I think the challenge in transforming any system is that there is no perfect system. I do think that, though, Indigenous-led systems are going to be stronger in the approach to understanding how best to care for families and for children. And this legislation of C-92 is indeed designed to restore power, rightfully, as President Obed said, to Indigenous communities who wish to resume the control of child and family services within their own communities. Will it be seamless? I hope it will be as seamless as possible. But of course, we're always interested in hearing how better we can support that work, and it is in its early stages.
Thank you. Thanks for your time.
Thank you very much.